Thank you, Mr. Chairman, and thank you to the panel members. I want to follow up on some of the questioning that Senator Warren started with, because I had similar concerns. Medicare Advantage and this vertical integration. I guess my question, Mr. Martin, is to you first. The Affordable Care Act requires the MA plans to spend at least 85%, right, of premium revenue on health care claims. But when these plans acquire related services like PBMs or physician practices and home health agencies, they're actually able to skirt some of these medical loss ratio requirements. Isn't that correct?
That's correct.
And so can you talk a bit about this trend? What's the relationship between the medical loss ratio rules and increased vertical integration and the impact?
Well, I think thank you for the question, Senator Cortez Masto. I think diversification of services allows them to apply more services to the definition of the MLR as it exists today. The Academy supported MLR and its originating legislation continues to support it today. I think the intent of the MLR from our perspective was really to direct maximum amount of financial resources to clinical care and services that support clinical care. And I think the definition of that has evolved since the passage of the law and is probably due for re-examination.
By us, re-examination by Congress, take a look at really the impact. Is it really having the intended impact of its original intent?
Correct.
Okay, thank you. I want to also jump back to some of the conversation earlier about private equity. From 2011 to 2019, the number of hospices that are owned by private equity nearly tripled as investors pursued growth potential and profitability in the end-of-life care. When states surrounding Nevada increased their oversight of this industry, hospice moved to Nevada. And we saw the number of hospices in Clark County more than double. In fact, according to CMS's December 2022 Hospice Oversight Report, Las Vegas had 110 certified hospices. And just in comparison, New York State had only 41. And some of the hospices are now being identified as these churn and burn hospices. And what I mean by that, they are enrolling as many patients as possible until they are either audited or they reach Medicare's reimbursement rate. Then they close their doors, they acquire a new license along with a new Medicare billing number, transfer their patients, and start the whole process over again. And we literally in Southern Nevada have become the hot spot for these burn and churn hospices so that they can make money off of our seniors. And so maybe Dr. Maddox, let me start with you. With proper oversight of the hospice industry, I imagine we would see a decline in the number of profit-seeking enterprises, but heavy administrative burdens, what I see, are also driving these mom-and-pop shops to join larger consolidated entities. So how do we balance that need for strong regulation that protects our patients with the importance of encouraging a competitive marketplace in this area?
So thank you, Senator Cortez Masto, for that question. I think I first 100% agree that the kind of really horrifying abuse and fraud that we see in this sector is outrageous and needs to be addressed aggressively. I think the way that we prevent that from negatively impacting the kind of hyperlocal, patient-centered care that hospice inherently must be is by being smart about the regulations that are put in place. And that means that we have better data on ownership so that the same people can't keep doing the same thing, that we have better upfront understanding of who owns what and what they're doing, and that we create a better real-time data infrastructure to understand these things so that we're not looking back 5 years later and saying, what was the effect of private equity on industry? That we're watching on a quarterly basis to understand quality outcomes and patient experience in every place that Medicare is touching with its dollars. It's well within the purview of Medicare to ask for information about the dollars that it is being spent. And in some industries, that's quite underdeveloped. It's difficult to think about data in hospice, right? Your patients die. And it's a tough thing to ask about, and it's a tough situation to be in, but we need to do a better job of developing low-burden data infrastructure to quarterly update our evaluation of every single entity providing care, particularly to vulnerable populations.
So there is a role for us to play at a federal level along with at the state level, and state and oversight in this area, correct?
Absolutely.
Thank you.
Yes,
Thomas,
thank
yeah.
you, Senator. So in our community in Grand Junction, Colorado, we have a community-based hospice that we've developed together. It's a not-for-profit. I sit on the board of director. Most of the healthcare leaders in our community do, and we are at risk of closing this facility. And so one of the successes I think you see in our community for keeping the cost of care down is we have such a robust palliative and hospice care. We're taking care of people. We're making sure they communicate. We talk about end of life, that we're not, I don't want to say wasting, but we're not spending unnecessary resources at the end of life. And as more and more rules come out to go after those bad apples, it's crushing us. And we're at risk of having to close our community-based hospice. We've already had to reduce our expenses 20%. And it's just that trickle-down effect that we have a marvelous hospice system. It's called Hope West. And unfortunately, I'm not sure. We have a new CEO that's just fabulous, and she's going to fight like hell to keep it open. But we're very worried about that and what it will do then to the cost of care in our community.
Thank you. And I know my time is up, Mr. Chairman, but I think this is an area we absolutely need to focus on when it comes to private equity and this idea where they identify these unique areas in healthcare. Right now, it's hospice. It could be something else. And I think that's for us to kind of figure out, understand what is on the horizon as well, but how do we put regulations or support in place that aren't going to put hospice care, like Mr. Thomas talked about, out of business as well?
I want to thank my colleague for her leadership on this issue, and I was aware that you had been digging into this. And the fact is that, as my colleague has said, there are substantial amounts of federal funds here. And our oversight team here at the Finance Committee is looking now at private equity in hospice. And we very much appreciate working with my friend from Nevada, because these are hugely consequential issues. And I continue to believe that good quality care and smart policies for taxpayers are not mutually exclusive. We can do both, but it requires the kind of leadership my colleague is talking about, and I look forward to working with her. Senator Thune.
Thank